Great. So we've got a few more people. Um, yeah, I'm just gonna sort of get us started. We have very little time today, so the goal is to see how much we can do within that period of time. Um, But yeah, hi everyone. My name is Ayodele. I'm co-founder and CEO at PneumaCare. And during the course of this webinar, I'm going to be explaining what PneumaCare is. But for now, I'll start by saying thank you so much for joining. And again, thank you to Peter. Thank you to Precious. Thank you to everyone that has joined the call as well. I'm looking forward to this conversation, and I hope that it's going to be a very fruitful and useful session to everyone. Just as part of the, prepare. I mean, the plan. I'm just going to share what the plan for today looks like. So, we're spending the next, say, 1 minute, breaking the ice and just getting to know everyone. We're going to talk a little bit about like PneumaCare and why we're thinking about the Adopt AI webinar series. I'm going to introduce the panel at some point, which is, Peter and Precious. We're going to have questions. So we're going to have a broad discussion. So they're just a series of questions that we have around, AI adoption in Africa, use cases, their experience deploying, AI solutions across Africa. I know Precious has some bit of experience outside of Africa as well, so that would be great. To also mention if there are probably, similarities we can bring in. And, if you have questions that were not addressed during this session, you can then, we have about 10 minutes to address those questions. And then lastly, we're going to go into what I call like a networking session. It's really experimental for us. Ideally, we want these sessions to be in person, but, the problem with virtual sessions is oftentimes people just come in and just breeze out. The goal for us is actually to see if we can potentially have like a mini breakouts networking session where you can get to meet and get to know someone else, and potentially there's something you can do for them or they can help you with. So it's not a sales conversation. Please try as much as possible not to sell. The objective of this sort of conversation and these sessions is to make sure that everyone can achieve and get some value out of it, as much as possible. So that being said, I'm just gonna go into it. So about PneumaCare, really just so for some bit of context for people that don't know us, we're a health service company. We think about ourselves as a healthcare service company, which means that we build and enable services that make quality healthcare more accessible to Africans. We technically are part of like the 2020 class, as I like to think about it. So, we worked a lot in public health and Health Africa and a few other organizations. And during COVID, as you'd imagine, I personally was sub-consulting for this, Cyber Disease Control and a few other organizations at the time. And we saw, the fact that the system was very siloed. And as you'd imagine, the goal for us was actually to think about the best way to solve it. Um, so that led us to launching PneumaCare. And, we're lucky we raised some money. Maybe not enough in retrospect, but we raised some money from Founders Factory, Pantemis Limited, and a few angels at the time, that helped us to be able to like scale the operations and also like, at least we delivered care to over 100,000 plus patients, served about 2,500 plus healthcare facilities across the country. And a suite of products that are still being used across some certain facilities today, to deliver and improve care experience for patients. And a lot of our work these days is now around being the orchestrator. I've written a lot about this over the last year, and happy to share some of these resources later, as much as possible. And how do we think about our model? I think this is probably just we're quite open about our model because again, like I said, we started in 2020, 2022, 2026. It's just about 6 years, but really it's been a lot of experience for us. We also think that there's a lot of lessons that needs to be learned in the space. So we're quite open in terms of our approach to, technology, our approach to like, addressing the market and, trying to like find scale as much as possible. So we adopt what we call like the program-led growth model, which is basically rather than us building solutions to sell to patients directly, we build our solutions, we partner with nonprofit organizations and governments to actually find skill within their program. So which means our goal is not necessarily technology. It's about, their problems and, how we can potentially build for those problems. Some of those will be discussed within the context of our conversation today. And, I really hope that, we get something useful out of it. But at the core of what we've done, is building this, what we call like an API first infrastructure. And that's really where we started from. APIs that allows developers to be able to build, patient-facing solutions faster and also connect to, at least about 2,500 plus healthcare providers across the country, across, different specialties from dental to vision to primary care. Normally, if you're going to build that today, everybody has to build their network. And our goal was actually to just build one single network and allow people to be able to plug and play into that network as much as possible. Um, that said, today we're in an AI world, and so if you were, I would guess that everybody on this call is thinking about AI. Olakle, I know you're very big on AI within your startup as well, and the interesting way and the metaphor I like to think about AI is, very similar to what you have in the oil sector, right? Where you have the downstream and the upstream, and then you have like, everybody, finding the best ways to create value. Um, for us today, right, we built our first, what we call like then used to be called Chat GPT wrapper in 2023 or 2024. And that was because we had the telemedicine product and people would basically come for the most mundane things and would not want to pay for it. And our approach was actually what's the best way to reduce doctor hours, rather than having to spend 40 minutes to 1 hour on a consultation with someone who is actually not going to pay and it's just headache, right? And the approach pretty much was actually let us use an AI, chat GPT at the time, and we wrapped around it to build something simple. And it worked for us, right? I talked about how, we saved about 20 hours every week in free consultation time. And we also were able to like drop down our onboarding, increase our activation rates about 25% thereabout at the time. So it was useful for us. But then also today, I think there are a lot of people that are building, and you can really play across all of these models. I would imagine that for every company here, you are either playing at the vertical layer where you are building solutions for providers or for patients, or like administration software generally, um, or you're basically building workflow orchestration software. Someone like Precious works with open function, and a big chunk of the work that they do is around the workflow, orchestration and integration layer. Um, then you have evaluations and which is really the core, right? For most people, you think about like evals, and you probably have heard about evals previously, but a lot of work that we do today is actually working and partnering a lot more with you know, health systems and programs, as well as like innovators to actually think around evaluation for their models. And in that case, it doesn't matter if you were, using OpenAI, Anthropic, or Google, or any of the available models, or you're actually just building your model yourself, and you're trying to find application for that model within the public health, within any public health program. So a big chunk of our work really is actually establishing those relationships, and helping you find, the best ways to measure and get trust. The way in which I think about this really is very simple. So I remember when we used to sort of like pitch our software, you would say we're the best, we have the best feature, and all of that. But the truth of the matter is, imagine you're saying that to say a non-profit organization. I can see Farmestel from DC Blue, in the call. So if you're pitching that, one of the first questions you're going to ask is, how have you validated that, you have the best model? That then means that you need two set of things. You've actually done the evaluation yourself, but beyond that, you actually tested that evaluation with their data sets or with like, data set that's within the context of their operation. So we understand that a lot of innovators do not have those data sets and do not have those, program level insights. So we are able to do the work of, giving them access to localized evaluations and, evaluation data sets. And from like a health program standpoint, a big chunk of the work that we then do is enabling, safe adoption and allowing organizations to easily transition to like, AI solutions that meet their program needs and objectives. So that would scale from things around readiness to things around, understanding the switching costs and make it just easy for organizations to make a decision around should we adopt this solution or not adopt the solution at this time. So that is really just it. Again, thank you so much for everyone that has joined. Really, really looking forward to the conversation, and I hope that we're gonna have a lot of fun at it. Um, so I'm just gonna move to the next piece. So next is talking a little bit about the panel. So we've got Precious and we've got Peter. I mean I have their bio up here, but I'll just love for Precious to start with introducing himself. And we can take it off from there. Hi, Precious.
Hey, thanks, Sarah. Hello, everyone. Precious Nwiko is my name, as you can see on the screen, obviously. I work for OpenFN, the country lead, Nigeria country lead for OpenFN. For a bit of background, I started my education journey, a bachelor's with information systems degree, and then really focused on computer networking. So the early part of my career was working for ExxonMobil, deploying network switches, voice over IP radios, and phones across offshore locations. But somehow I ended up in health, and my first connection to health was deploying visibility systems for health commodities. So I did that for a longer period, for about 10 years, working with Clinton Health Access Initiative, deploying digital solutions across different disease areas, immunization, and the likes. And then did some time with the government after supporting the government through the NGO. I then worked with the government, the ED, MPACDA for a bit before joining OpenFN to deploy the workflow orchestration layers and all of the work that we do now. Happy to discuss this topic and nice to connect at the end as well. Thank you.
Great. Thank you. Fantastic. Thank you very much, Precious. So just for everyone, I'm launching a four-question poll, just to just get your perspective on a few things. So you'd see that it's going to take less than a few minutes to respond to. I'll probably just share the responses at the end of the day, please. Okay, great. Peter, do you wanna do an intro of yourself, please?
Uh, yeah, sure. Good afternoon, everyone. My name is Peter Bunor. I lead the commercial team at Field Intelligence, co-founded the shelf life business. We started Field in 2015. And, our work initially started with building out solutions that were really focused towards solving core supply chain issues. We currently work across both governments, INGOs, private facilities. So we work with private hospitals, pharmacies, drug shops. Every setting, the way we like to describe it internally is every setting where care is delivered, we work across all of those settings, and we work on two primary tracks. On one level, we provide the software to help with the planning, forecasting, management, distribution, and utilization of commodities. On another level, we are a licensed pharmaceutical distributor in Nigeria and Kenya, and we deal with manufacturers and source those commodities and provide them to these facilities to use. We obviously orchestrate all of that using the same kind of software that we have built, and that's how we currently work. That's it from my end.
Great, thank you. Really nice to have you both. I mean, I've known Peter for a while as well. And Precious, we overlapped just a little bit at Open Function. So really great to have both of you on the call. So yeah, please, we've just got about three people who have responded to this. Looking forward to seeing the responses generally to the poll. So just to get started, and I just ask this question. I think this is for Peter. Um, you know, 10 years, right? Or 11 years now, building building and being active in this space, outside your general work previously. Um, how would you imagine, I mean, how would you describe the critical problems that, innovators generally face, should be solving, not like the problems that they have, but what problems do you think people should be solving today with respect to AI when it comes to like health systems in Africa?
I think that's a pretty loaded question because the problems that we face, at least from my lens, are not all technology problems, right? And so we have this tendency on the continent to take whatever new technology is and assume it will be a silver bullet to solve whatever problem that we're dealing with. There's a lot of process problems, there's a lot of people problems, there's a lot of problems that are external to, if you look at health systems generally. So you look at the macros, right? What does the state of the economy do to purchasing power? What does that mean when originators are not available or are not present in your market? There's all of that conversation ongoing. But when I think about what I think people should be building in this case, I think that there's a lot of opportunity across different vectors, right? So if you look at, I've seen some interesting experiments recently being done by a group in Kenya where they are using AI for medical decision support and decision aid, right? I've seen another group experimenting on something for case notes, taking case notes and case notes management. But all of those things are in the clinical space, right? So all of those things are happening within hospitals, either primary or secondary care. I think that there's opportunity to look at what becomes transformative if you take AI to the pharmacy level, for example. Again, for people who know or people who don't know on the call, in Africa, the first port of call for most sick people is the pharmacy. And so how do you take that technology and embed it within the workflows that are present in that space, and what can it do? What can it do there? Beyond the obvious supply chain issues, and we do a lot of work on the supply chain component of this. I think everybody is familiar with the Strait of Hormuz and the disruptions in global supply chain in recent time. Supply chain is interesting in that sense because it takes a negative event for everyone to pay attention to it. When everything is fine, nobody pays attention to the supply chain typically. But what you then see is that there's impacts on forecasting, on planning, on stock management, on load balancing or redistribution. And so there's work that I think can be done. And I say that because if you took a view that looked across, say, all public facilities, right, what you will find is you have certain pockets where commodities are either overstocked, and I'm zeroing in on the commodities bit of this just to make this point. Commodities are overstocked, whereas you have other pockets where there are no commodities. What you need there is some way for everything to speak to each other, and then you can move directly, right? So you can move things from a place where it's overstocked to a place where it's not as available. That's some of the work that we are doing, but I think that that's just on the public sector. When you go into the private sector, how do you orchestrate such things? How do you orchestrate planning? I think that the planning component is one of the biggest missing points in how we think about the healthcare supply chain on the continent. And AI helps with routes, large scale calculations and things of that sort. So yeah, those are my initial thoughts around that.
Interesting. Thank you. Precious, I mean, I know, Peter just talked about, the situation where you have like, overstock in one place, and then in another place you probably just have, you have like shortage. Is that like, I know that's probably like some of the problems you're solving across, a few countries. Is that correct? And
Yeah,
how are you solving that with like automation today?
absolutely. Those are very apt use cases that Peter mentioned there, and they're exactly some of what we're solving. So, for example, we're in the process of embedding AI using some of the foundation models that you showed in your previous slide into actual ELMI solutions in countries where some of exactly what Peter is describing would then be done. Using OpenFN, of course, as that orchestration layer so that governments don't build new AI models, but leverage the existing AI models to be functional. And like, excuse me, like, oh my God.
Sorry, you can take a minute. It's okay. It's quite loaded.
So yeah.
Right, cool.
All right. So yes, that's what we're doing. One other use case that we're working on, for example, it's connecting temperature monitoring systems to existing applications that are used by health systems. So look at coaching temperature monitoring systems, for example, for management of vaccines. For the longest, those systems have been in silos. So how do we connect those systems to one point, and it could be the field intelligence application, for example, or any ELMIS solution that is out there. Have all these temperature systems connect through OpenFN into one ELMIS solution, and then connect AI to them to intelligently know when a health facility is going to have a breakdown of the coaching equipment, so that the temperature sensitive commodities that are in there can then be taken out and prevent use of wastage, exactly.
Yeah.
Um, so those are some of the use cases. One other thing that we know across multiple countries that we've engaged is that there are a lot of these AI policies that have been written and just gathering dust in a lot of these countries. So a lot of times when we engage them, we are trying to bring a lot of what they want to do to life through orchestration, of course, because that's where we lie, and as OpenFN, and then help them build AI assistants and AI agents through the connection of their applications, existing applications, mostly to AI foundation LLMs.
Interesting. That's I mean,
Mm.
you did mention the conversation a little bit, and just to segue just a little bit, you did mention the conversation around how you extend existing LMISs to use AI capabilities within Open Function without necessarily meaning that you are rebuilding those LMIS systems. Is that correct? So, which means
Absolutely.
so rather than having to spend the $100,000 building a new, OpenLMIS or a new version of, OpenMRS, you're integrating AI into, I mean, through Open Function, you're using Open Function to integrate AI directly into the software, and things just continue to run that way. Correct?
Correct. So
Yeah.
two things we've seen being requested mostly, it's to have an assistant, some sort of chat box within existing systems, right? And then also then use the data. A lot of these systems over the years have collected a lot of data within the healthcare space.
Hmm.
Try to use that data to intelligently inform what healthcare workers and health managers can do with them.
Great, thank you. That's useful. I mean, that sounds less of AI-enabled, softwares to AI-enabled systems, all right? Because now you're thinking at a systems level rather than thinking at an individual software and embedding use case. Interesting. I'll just go to the next question. Peter, I'm going to come back to you on this because you have tremendous experience in this. So I'd ask. Um, what government, backed or non-profit sort of like led deployment experience recent times, maybe from some of your work in Kenya or the examples you gave, that you've seen recently, and you think that, these are specific lessons that you think is useful for folks building within this space?
The first one that comes to mind is probably some lessons from the deployment in Rwanda. And while that is still ongoing, so there's not much, there's things can't necessarily get into yet.
Right.
It's it's I think if you go back to the foundation basis, whether you think about it from first principles, you can't leverage artificial intelligence when you don't have data, right? And even when you have data, the data is not collected or annotated properly. There's not much you can do on top of
Hmm.
with, right? So when you get into a system where at least that foundational base exists, right? The data is collected, the data is cleaned, there's an appreciation of the utilization or the need of data for data in decision making and decision support. It makes the process easier. If you juxtapose that with some of the things we see in some of the work in Nigeria, what you find is that a lot of states don't have that foundational basis, that foundational layer. Now, this doesn't mean that things don't exist. So let me, yeah, so there's all sorts of data that exist, actually, like Precious has mentioned, within the ecosystem. But what you don't find is very simple things like standardization, standardization of master data requirements. So product names. In fact, something as simple as standardizing facility names, right? Or facility lists. And you don't have very clean list of that. And what that would lead to is you lead to double counting and things of that sort. And so just from that foundational basis, it's virtually impossible to talk about leveraging the power of AI to without solving at that base level, right? Fix the data that exists. Actually, first, figure out what data exists, right? Clean it up. Put all of those data in a format that is uniform. Agree on standards, and then you can start from that point to think about it. You're muted, Ayodele.
Precious, do you have any comments on that? Probably something you want to add with respect to your experience. I know you've been doing a lot of work in Rwanda as well in recent times.
Yeah. Rwanda, to start with Rwanda, we're trying to work in orchestrating some sort of data hub. But that, like Peter mentioned, a lot of that work is not yet in our own work is also not yet to in a stage where we could speak so much about it. But funny that Peter mentioned the health facility list. That is exactly a problem that I'm trying to solve right now for a different country. So it's a fact that it's a big problem. A lot of the data that exists are either incomplete, inaccurate, wrongly taken down, or just in a physical copy form. So and that's some of the problem that we are dealing with. But in terms of your question around government-backed and non-profit deployment, I think one example for OpenFN is what we are doing in Bhutan. For Bhutan, for example, they are bringing in some of their policy documents, their strategy documents, to get their digital transformation teams to have an AI agent that can help query those documents and help them execute, reference the documents, reference their own national policies in real time. And this is a very fundamentally different model from traditional technical assistance, where we're embedding ourselves within data transformation units to help them use their existing policies to take decisions as opposed to doing it the other way around. That's another example I can add there. Over.
Right. Interesting. So just to sort of try to reframe that, that sounds more to me, first from Peter's point is around the gap right now in terms of standardizing data and making sure that the data is actually AI ready, right? On one hand. There's also from your experience the realization that selling the software is not just enough, right? Embedding yourself as, within the teams to help them implement is probably like another thing that you have to do within the space. Is that correct, Precious?
Absolutely, yeah.
Fantastic. Great. Please, just to say, I noticed a few more people joined whilst we're on. Please, there's a poll. Please feel free to sort of fill it. We'll share the responses afterwards just to make sure we see where we had. And then if you have questions, please save them. There's going to be a chance for you to sort of like ask any question afterwards. Um, Precious, I'm going to come back to you on this. You know, how do governments, and probably non-profits as well, approach AI? What's their perspective of AI? Is this still from the, standing far, not trusting, excited but cautious? So, what is your thinking and perspective around, how government and non-profits generally are approaching AI?
From experience, I've never been in a room where a government official is instantly asking for AI. They usually come with a gap. There is actually maybe a reporting gap, a supply chain failure gap, some sort of system gap. And then that usually leads to improving of the system, obviously, but sometimes also then, most times where I would like to be is where technology is brought into the discussion to help improve that. And what we have seen, like you alluded to, is um, the data sensitivity. The first question is where is the data kept? Who owns the data? What data will you be using? Largely for the longest for Nigeria, for example, there haven't been a very clear policy on the storage of the data until recently with the new data laws, and that's quite clear now. And even when it's clear, when you talk about cloud services, what defines a cloud service that is owned in country versus the one that is not? It's an AWS data center in Nigeria, a Nigeria-owned data versus a Nigeria-owned cloud service. Some of where the guardrails are at the moment, aligning on how safeguarded AI is for governments to implement them. But two things mainly. Governments, first of all, come with the problems, and the partners and the technology teams help them land on a digital solution that ends up with in AI in recent times, and then that translates into some security and data safety discussions.
Fantastic. And just to sort of push a little bit on that, thank you for that. So the government have come with, let's use maybe the CCDX program that you're on right now. So the framing was we have thousands of temperature sensors across different coachings across the country, but we cannot know, we don't oftentimes don't know what's happening. Some of these temperature sensors are old, right, and we have very new ones. Now, just to sort of then ask the question, so imagine you are coming into that meeting and then you're sort of pitching them on AI. What is the reception going to be like? Because then you're going to ask you, how are you going to solve this problem? You mentioned AI. What is their reception to it?
Yeah, it's so like you've described, the first thing is the problem is the silos in temperature sensors. You have to first of all define how you're going to limit or reduce that gap in the independent. So in a place like Nigeria, there are at least 9 to 10 different temperature systems, at least two major ones, but there's so many across multiple coaching equipment. Being able to connect all of them together and show that that has worked is the first step, right? When you do that successfully, you get their attention. And then in the process of showing that data working, showing that data being used for action, then there will be gaps and need for AI. You have to show the stakeholder what the gap is and what will be the use of AI. From experience, when you do, in fact, I've come to realize that stakeholders will usually not engage with AI until they actually see the value in what it's going to produce. And that's where, for the CCDX in particular, after we were able to change functional status of equipment based on the temperature status of an equipment, then how can we then predict which equipment we break down next? How can we predict which equipment we need to take vaccines out of? How can we predict where we don't need to store vaccines or send vaccines to? And then that becomes value.
Great. Interesting. Thank you. Peter, do you have any thoughts on that?
Yeah, I mean, like Precious said, the government typically will come with a problem statement, right? And that problem statement doesn't really care about what technology stack you're using to solve that problem.
Right.
Vaccines are, we're getting temperature excursions for vaccines in XYZ number of places. How do we solve this problem? They don't care if you want to reinvent a new language, the ways they want to solve.
Yeah.
So there's that first, foundational point. What then happens, or what I've started to see a bit more lately, is you then have some people in government saying, oh, are you going to use AI? Right?
Okay.
And for a lot of them, what that means really is, are you adding a conversation bot on top of it? Let's be factual. That's what a lot of people hear AI and immediately just assume it's a conversational AI, ChatGPT type wrapper, like you sort of described earlier. And so that's what a lot of them conceptually think when they think about, will you add AI or will AI be used here? It takes a bit of education to get to the point where you're like, look, if there are routine functions that are rote that you perform regularly, we can automate all of those and put intelligence behind it. That is AI in and of itself, but that is not as appealing as the, I want to type into a box and I want it to, pull out all sorts of things from my data for me. So you have to deal with that barrier where it's almost like, slightly disappointing and not as cool as they want to, as they want it to be. Again, you have to understand that government officials typically are making decisions for reasons that are often different from the technologies that are building the tools, right? The government official wants to solve a problem, but also wants to look good in solving that problem, and wants that solution to also look very good, right? Which means that sometimes you have a case where there are sometimes often simpler ways to solve certain problems, but it's not as appealing and doesn't have the same sort of gravitas as something that might be a bit more complex in a sense. And so you're constantly having to navigate those things to get to a point where the problem you want to solve is clearly defined, the technology stack that solves it most effectively for you at that time and is sustainable is also defined, because that's the other big issue, sustainability. Credits cost money. Who is going to keep paying for credits if you want to keep, chatting with Claude and whatnot consistently? All of those things are very often overlooked in the initial phase. We just, people just come like, I want AI. They say AI can do it. How can you do it for me? That's what I would say.
That's very interesting. And just to, I just sort of like buttress that, maybe not with my point, but sort of asking, for validation in this. Does that sound more like the use of AI for some of the government staff today is going to be more around I use this thing rather than this thing does it for me?
Yeah, I think so. At least from my perspective, that's what it is. Because if you think about it, right, we've dealt with actual scenarios like this. This thing doing this for me, what that conveys is the fact that that person can be replaced, which means
Right.
that security starts to get threatened, and
Right,
you now
right.
start to get some opposition to a thing when it's automatically doing it for you. So you have to sort of wrap it in a way where, yes, it does it for you, but it needs you to ask something or do something so that they feel like they're a part of that process versus them being completely removed from that process.
Great, great. That's fantastic. Thank you. Precious, does that make sense as well? That sounds like your experience as well, correct?
Absolutely.
Yeah.
Nothing else to add there. That's
Cool. Yeah, so this is still to you, Peter. I know you've already hinged on it. Just, you can pass on in as well. If you were a startup or an innovator, I like to call it innovators because, they are researchers and they are, organizations generally. So if you were an innovator and you were building, a product today, how would you sort of position and approach it, with respect to like, health systems integration? Would you rather integrate or you'd build as a product that they can just buy like, off the shelf?
Uh, that's that's not an easy thing to answer, and you know this as well as I do. Selling into health systems in Africa is perhaps one of the hardest jobs in the world. It's one of the quickest paths to getting gray and losing your hair. But then the reality is, if you are building for that market without access to those health systems, you can't get the validation that you need. So it's almost a bit of a chicken and egg problem. How do you attack it, right? My current thinking, where I am as of right now, is I think at some point we need to figure out how do we get a sandbox in a sense, right? In financial services, you have sandboxes where you can build and test things and deploy things into where you can test. I think we need to figure out a way to get sandboxes. And I think that's sort of being worked on the Nigeria side, if I'm not mistaken, right? Get a sandbox, test, then you can have evidence to further conversations. Because if you build, say you start a company, it's completely venture backed, and you build a business that is completely venture backed, and you want to sell into these health systems, the issues you are dealing with are extremely long sales cycles. The path to funding is not clear because you have some funds are it's either a pool of funds where donors are contributing a piece and government is paying a piece of it. And each of these groups have their own requirements or preferences, and you have to sell to all of those groups. So it's not the easiest thing in the world, and it's perhaps why you won't see so many people trying to build and succeed in that space. The other way to approach it, though, is to solve a problem or build for who has the money. And this sounds a bit, extremely just capitalist. But when I say build for who has the money, essentially I mean find a donor with a problem in a space that they are working with or working in, and build solutions that address those things for them, right? Again, sales cycle are long, review processes are hard, but if you can get in that door, they then become your, again, because if you know how the healthcare system in Nigeria is set up, they then become your advocates, right, to get it in. So that's a lot of that was focusing on the public sector. If you're building for the private sector, I think it's slightly different because then you are dealing with competition. So, for example, my favorite example to use is POS, point of sale solutions for retail pharmacies. There's like 1,001 of them in the world, right? So you have to then compete on price, compete on differentiation, compete on sunk cost, because almost every pharmacy you know has a computer and a thing that they built, right? So how then do you differentiate and get them to switch? So the opportunities, the problems are large, just the opportunities for you to earn return on capital are not as clear. That's how I would put it.
Right. So, so does that then mean in that case your safest route, which is also which is also difficult, is to go the what we call the program innovation approach, where you're finding a donor that has a problem and then you're trying to solve for them and convincing them to sort of like do that. Is that what you're sort of like leading to eventually?
I think that it's probably the route that gets you to actual deployments, but also gets you paid faster. Yeah.
Right. Interesting. I hope that's useful to anyone that's listening. Great. So just I think we've got just two questions. Sorry, again, if you have questions, feel free to drop them in the chat, or you can just indicate to ask directly and we would call you up. The only caveat is if you're asking questions, please you have to turn your video. Um, thank you for that. So I think we've talked a little bit about like, trust. Let's think about this a little bit from a patient standpoint, right? What do you think the perspective of patients are right now with respect to, you know, AI and digital health generally in Africa? This, I think, maybe would be for you, Peter, as well. And Precious, if you, I mean, you as from a perspective of, someone that spent some time in this space, you probably also have questions, I mean, responses from a policy standpoint. What's the perspective of a patient? How trusting idea of AI when it comes to like healthcare today?
What I've seen, again, just looking at some experiments that I've seen lately, it kind of shakes out into, there's two different types of it. There's one group where you know that there's an AI-aided or AI-powered response that is in here. A lot more of what I've seen lately, the patient doesn't actually know that, some of that is, there's some AI in the background here. Now, you can have the conversation around the ethics of it and permissions and what that does.
Yeah.
I've seen a lot more of the latter. And so when I say that you have groups using for decision support, for case notes management, for follow-on, right, for follow-on and scheduling, a lot of those times, at least the examples I saw, the patient has absolutely no clue. Right. So it's hard to speak to, specifically what's the
Sorry, just 1 minute. I'm gonna mute that person.
It's Ebenezer, I think.
Yeah, where okay, found that. Thank you.
Yeah, so I'm saying it's hard to speak to specifically what the patient perspective is on that side, right? It's not very overt. You are simply speaking to a doctor and he's typing on his computer. You have no clue what's going on there, right? So there is that part. Now, on the other side, when you see that, I've seen also a couple telehealth providers try to experiment with an AI doctor, right? Again, even in the example you used, Ayodele, cuts down, doctor consultation hours, but, same thing I said earlier. Now, I've not, at least what I've seen with the case where it's overt, is there's an initial bit of skepticism. And there's also okay, where is this information going? Is this information going to leak? How is it getting used? But the reality is, from what I have seen, a lot more of the use cases happen without the patient being aware that there's an AI tool involved in this engagement and in this conversation.
Interesting. I think as we think about scale and adoption, we also have to be thinking about the ethics, right? So because it's clear. I mean, if I think some patients would want to know if you're using AI to deliver care to them, and that's great. Precious, do you have any points or anything to add there?
I think first of all, I agree that a lot of where AI is used mostly at the moment, patients might not know. If you look at triaging, for example, some patients when they come, they have no idea that they've just been triaged using AI. But where, even without knowing if AI is used, where we see a lot of initial kickback is if their data would then be used by AI. Patients want to be able to say yes or no to such decisions, or even categorically not allow that to happen, even when they are not aware if it's been used or not. So
Right.
I think that's the only thing about it.
Interesting. Thank you. I mean, we've run through the questions real quick. Thank you very much. Do we have questions? Happy to take a few questions, please. If you do have questions you want to ask, feel free to indicate, raise up your hand, or drop a question in the chat. We're just gonna wait for that. Let me see if I can get an eye on everyone. Questions. If we generate have questions, I think that's great. I mean, I did write just whilst wait for that. I wrote an article on. Okay, Kule, just 1 minute, Kule. So I wrote an article about, how my thinking on how scale should happen for healthcare businesses and, in Africa, thinking about orchestration and thinking about like, embedding in programs. I'll share that after this call in an email to everyone, so you feel free to read it. It just sort of echoes some of Peter's point around embedding in programs, as well as Precious's point around not just selling the software but working with the users to actually deliver on the outcomes, because that's what they really care about, not your software. Hi Clay, good to see you again. Yeah, you can unmute yourself, Clay. That's fine. Okay. I'm not sure. Okay. You're still on mute, Kune. You're still muted. And for some reason, your camera feels like like an artwork. Okay. Whilst we wait for Kune to get back, do we have anyone that have questions, please? Dun, dun, dun.
Can you hear me now?
Yeah, fantastic. We can hear you now.
Can you hear me?
Yes, we can hear you.
Okay. Yes. Yeah. So I think my real question is around
Oh, you've gone mute. Hi, Kune, you're now muted. Um, I'm just gonna ask you to unmute. Sadly, I can't unmute you myself, so I can only ask you to unmute if you can. Okay, yeah. I know. All right. Whilst we wait for that, okay, Claire is the only one that has his hands up. Do we have questions? Claire, do you mind? Okay, yeah, I think you're back now.
can you I don't know
Yeah, we
my
can hear you.
MacBook is just but can you hear me now? Okay.
Yeah, we can hear you now.
Okay. So my question is around education. Good. My question is around education as regards AI adoption. Because I feel one of the biggest challenge we might have is that the community that we're trying to build for, if they don't really understand how this works, it becomes difficult for them to actually translate their problem, into, or to be able to, they can describe their problem, but how do we then measure if indeed the solutions that we bring to the table actually solves the problem? Uh, because if the education level or the level of education around AI adoption is still very low, people can describe problem, but if they can describe a problem, but cannot describe it in the light of how technology can actually drive it, not specifically to solve the problem for them by themselves, but to be able to describe the solution, not just in a way that helps people to understand what they want. And then even eventually when we build for them, they also can indeed say, yes, this has actually solved the problem, not just because there is an output, but because it solves real problem. So kind of like, I kind of want to know what we're doing in that area to, take the education out there, because everybody should be able to use AI, or we can actually build a product, that's AI driven for people and just allow and just expect that they should go with it. That's what I'm really struggling with sometimes with how we eventually want AI to be adopted, at scale.
Right, interesting. So if I may reframe that question, would that sound more around educating the end users of this AI software um to be able to use the software or these new solutions? Or is
Not
it
just the, not just the, but AI, like the AI as a whole, like the level of education that needs to go into getting people to begin to understand what AI can actually do for them. Uh, what do we need to do in that area so that people can also start to co-create solutions with us, even maybe from starting to, properly define what a problem is. Most of the time, these people are able to like maybe articulate their problem. We're able to like define that problem, help them to properly define it and how it can be solved. But ultimately, we still owe it to them to be able to have that level of education that helps them to move with us across the entire chain and also understand and know indeed if we're actually solving their problem. That's where I'm struggling with, because most AI policies kind of like uh just like we mentioned, probably gathering dots somewhere. But is it really about solving? Is it really about we building, or people also understanding how this would actually help to really make their lives better, even without building? Because I believe that if there's a level of education that is obtainable, building becomes easier even for those that are building.
interesting?
I don't know if it's just my thought around that, and I just want the speakers to react to that.
Yeah, Peter, or Precious, anyone wants to go on that? Feel free to
Yeah,
sort of like probe back if you need clarity.
yeah, no, I'll try to answer to the best of my understanding of the question. Look, I think that there are different actors in the system, right? And if I was building a business that is AI powered or AI enabled, right? My intent is to solve a problem, right? To solve a problem that I expect or anticipate that my users have, right? The magic sauce in how it happens, I'm not necessarily trying to communicate that. So that is me speaking from the lens of, look, I'm trying to build a business that delivers this thing to you consistently, and it's like magic, right? So on that, there's that layer of it. If I were a government or a development, one of these development organizations working on this, and I want to get the communities where I serve to understand a bit more about the tools that are used, I can see that, right? I can see that, but my lens and a lot more of my constituency comes from building a business to solve specific problems, right? And who you're solving that problem for. I do agree that base knowledge, fundamental knowledge needs to be improved for everybody because, again, the quality of your prompts vary and will determine outcomes and all of that stuff if you're looking at conversational AI. But I don't know that that is the responsibility, and I might be wrong here, I don't know that that is the responsibility of the business to educate necessarily its users on how that solution works. And I can give examples of why I think that. I think that if you build something I've been looking at a lot lately, if you build a tool that can diagnose skin cancer, right, by photos, and you take a photo and it gives you a certain level of certainty and some form of diagnosis, would you have to explain the models that power that to the users? Do you get what I mean? I don't think that in that context, the users are looking for that. That's where I come from here. But maybe Precious has a different take.
So let me twist that a little before Precious goes. Let's think about maybe because again, I think Clay was being modest, in his introduction. Most of his work has been in the development space, largely. And I think so if we think about like healthcare workers, so think about like a community healthcare worker, I think that would be like the framing that Kunle is coming from here. So a community healthcare worker, how do what's the thinking around improving the education level of that, volunteer health informants in a village to then subsequently be able to maybe make requests or use the solutions that we're building. Kunle, does that sort of like leads into your thinking as well?
Well, I think maybe my question should have probably been reframed around how base knowledge can actually be increased, maybe from the perspective of maybe general education or maybe involvement in policy actors who are helping to strengthen AI system, maybe at a national level, maybe not necessarily from maybe a product or a business angle. Because I believe if there is enough knowledge about AI and the promise of it, I believe that we would have the opportunity to co-create or to, do more. Even the quality of prompts, would actually be better. Like I think I read somewhere like, oh, good, even when you have like you give AI prompts and everything, don't even say thank you. Because once you say thank you, you're kind of like, that's like additional cost to the people at the back end, who owns the tool that you actually use it. So, the level of education that I, believe that maybe at the national level, uh, I believe that is important because ultimately it will actually help to drive what we're doing. Primarily, you're right. Maybe at the primary, maybe at that level, people, in the community or, extension workers, want to be able to like connect directly to maybe something bigger, in terms of that helps to deliver this is. But I believe that there are a lot of things that that we're building for, that if we have micro builders, at the community level, we may not necessarily have to even be building some of the big stuff that some of us are even trying to build. And that's where I'm actually coming from, the aspect of education at, that level, that if education, if we're kind of like focusing also on, educating people, we may be solving a lot of problems at that level that we may not necessarily have to build a bigger product for.
Great. That makes sense. So two questions is coming out from that. First to you, Precious, and I probably just ask those two questions together. One is, what's been your experience working with like, government stakeholders, and maybe this will also come back to Peter in terms of educating around AI, opportunities with AI and maybe some problems that they should be thinking about solving, largely with AI. And also the second piece would actually be like, have you had experience co-creating or having requests to sort of co-create solutions that may then eventually use AI as much as possible.
Yeah, that's actually a very valid question from Kunle. What we do, it's in digital transformation units, and that will mean different things for different countries and different parts of government. For it could just be simply ICT team within a government agency. Doing that helps you build the capacity of the folks there and co-creating with them in such a way that they own these applications when it's done. The other part of getting to the community level, because the lower you go in the chain, the lower the capacity. So I agree with Kunle that a lot of this can be done at the national level, which is where we try to work at the moment. In fact, we're in the process of securing funding to be able to do this across multiple countries, where we go to the national transformation units themselves, the digital transformation units, deploy DPIs that are dependent on AI, for example, and build capacity in such a way that when that work is done, the folks in that government units can then deploy AI solutions for different problems across multiple sectors within their country. And that's how at OpenFM, that's how we are thinking about it. But when we have a service team that deploy OpenFM and build capacity on the go as well. So that's the way we think and deploy systems at the moment.
Great, interesting. Peter, you still in? Okay, Peter.
Yeah, I mean, when you think about it in that context, so I get what you mean. I think, there's a certain level of upskilling that needs to happen if you're looking at that. I think it'll be super helpful. But again, the way I think about it, right, the lens I come at it from is the job to be done lens, right? If I think about a community health worker who I already think is overburdened, and I think or a worker in a health institution, either a PHC or a secondary facility who I think is overburdened, my first instinct is to provide as much support as possible to lighten that load, right? Reduce the cognitive load on them, reduce the physical load on them. And then, but in the course of getting to that point where I can deploy that tool, I would definitely have tried to have some sessions where we walk them through, this is how this happens. So for example, there's something we launched with Field called EPOD, Electronic Proof of Delivery, when things are moved, how you get, notifications and whatnot. All it did was to smoothing out the last mile delivery process and the confirmation process, right? But to get to the point where it's rolled out, you then have to have engaged with the people. They've seen it. You've taught them a bit about how it works. They tried it. It feels like magic. Everybody's happy. That doesn't mean that they are suddenly experts in, delivery validation or geofencing delivery locations, but they have a very basic understanding of the tool that has been made for them to work with. That is the lens that I approach it with. I think there's things that are typically beyond the ecosystem when it comes to the general education and base level upskilling of people. But if you are able to provide contextual knowledge or contextual information that helps them understand why am I asked to go and find out how many people have taken vaccines this month? Why are these the kind of questions that come when a person says no? I think that helps delivery, and that makes it more real for them and ensures that they are able to utilize the tools better, but at least they understand the things that are powering those tools and why they need to make those decisions. That's how I see it.
Great, thank you. Thank you. This has been really fantastic. I'm not sure if I know we've run out of time for questions, but yeah, if anyone has any other question, that would be great. If there are no questions, thank you very much, everyone. Again, it's been an absolute pleasure having you on this call. Many thanks to Precious and Peter, and yeah, we look forward to seeing you in the next one. We would definitely communicate the dates. We're looking at sometime mid-June for the next session. And we hope to see you again. And please feel free to engage with the artifacts from these events as you see them over the next week. But again, thank you very much, everyone, and have a very great weekend ahead of you. Cheers.